like watching popping corn. You have to wait for this pops to slow up. My name is Robin. I'm at Southeast Louisiana AHEC, and I'm the director of the AHEC Scholars Program here. And I'm really excited because this is our first of hopefully many future collaborations. We are currently joined by Jennifer Bailey for our very first journal club meeting with the Southeast Collaborative. And I'll just go ahead and give a quick introduction of Jennifer, and then we can get started. Jennifer is the Associate Program Director of Education Evaluation for South Carolina AHEC. She was previously at MUSC, focused on interprofessional studies, and she is an alumna of Appalachian State University, UNC Greensboro, and USC. That's a lot of sounds all in one place. And so Jennifer has kindly offered to facilitate today. And so I'll go ahead and just let her get started. I'm gonna stop sharing the screen now so that we can have a better sort of setup for our conversation. And there you go. Thanks.
Great. Well, I apologize. My allergies have been acting up. I might mute myself to clear my throat. So welcome, everybody. My name is Jennifer Bailey, and I work in South Carolina in Charleston. And like Robin, I oversee the AHEC Scholars Program, and ours is a statewide program. So we have at least 4 students I know from South Carolina on tonight, representing pharmacy. And I also wanted to point out we had audiology, public health, epidemiology, dental. I saw some psychology. I have a background in public health, but also in health education, so health professions education, and college student development. That's kind of my area. Also telehealth in our state, telehealth education. I wanted to ask if there's any questions getting started, if anybody wanted to say hello. Any questions before I get started? Did you all read the article or get the gist of the article? Okay, if you have any questions, feel free to type in if you would like to. All right, so we're going to get started. Hopefully you all read the article. I think it's important to recognize that this article was written around May and published in May, and based on May numbers. And so we know that even more folks have died and even more have been impacted by the COVID-19 pandemic. So with that in mind, I just wanted to start off with a few discussion questions. So in the article, the article identifies 3 ways that long-term and widespread uncertainty, multi-dimensional stressors, loss of protective factors, basically those are the ways that COVID-19 is particularly and uniquely detrimental to mental health. And just want to open up the floor to ask, how have you seen this exhibited in your own personal or professional experiences? And that can include at home, the office, or at school. Okay.
I'm happy to talk a little bit. This is Nora. I'm from New Orleans, AHEC, well, Southeast Louisiana AHEC. My very best friend just finished up the licensed clinical social worker program, and she got like her dream job out of school. It was like at the same place that she did her preceptorship, but everybody at the workplace is so burnt out and just like overworked and overstressed. and it seems like a really big mess. So, it's a bunch of people that are providing mental health care, all in really poor mental health themselves. I don't know if anybody else has heard kind of similar things.
Well, I will jump in and say it definitely is highlighted in the article, at least that, looking at mental health and healthcare providers in general, their mental health as they may be vulnerable because they're dealing with the front line issues and the increase in demand. So has anybody else in other areas seen burnout?
I work with a pharmacist at one of the hospitals local to Columbia, and she runs like an HIV ambulatory care clinic, which is normally like one of the more like low key things in the hospital system. But she said that it's been a major stressor over the past couple months to basically reformat everything and the way they operate and the way they do things. It's a lot of one-on-one like personal interaction to sort of like shift into telehealth to have like every precaution in there and kind of stay up to date with it. So I know that's been a big stress for her. And then the hospital's been taking on other projects too. Like she's now in charge of like a convalescent plasma donation project that I'm involved with too. And that's just to facilitate the plasma getting to the hospital. So I know that she's been put on a lot of stress for that. Basically, like a lot of the people at the hospital are doing other things kind of outside their original job description because of COVID.
Certainly can see that the workflow changes, scope of practice changes, just like they mentioned in the article, routine changes every day, just that constant. It's like microaggressions, these small incremental changes over time just can wear you down.
Hi, I'm Shakara. I think I've experienced as a student therapist a lot of imposter syndrome, a lot of imposter phenomenon when I'm having all these clients. And I can't speak for my colleagues, but I think they're also having some of that too. These are such huge issues. And when you feel like you tackled one little thing in a client's life, this other huge thing comes up, and COVID's really not going away right now. And so people are coming in with one issue related to COVID, like, oh, I lost my job. And we kind of get that situated until, oh, now I have to be a teacher for my kid, and I've never done this before. And so I think for me, I've been experiencing like, do I know what I'm doing? Am I helping you guys?
Certainly. I think I was speaking to someone today about imposter syndrome. And, I think one of the things that I noticed is that it's this, again, it's the mounting, it's everything. And it's to begin with all of the stresses, it begins to feel like everything is almost too much. I don't know if anybody else has felt that.
Hey guys, I'm Tassine. I go to LSU HSC, public health student. Something that I've noticed, or when I was reading the article, they talked about how a lot of the adults in the society, they're going to be feeling a lot of role conflicts, and I feel like I've seen that in a lot of like family members and like coworkers who are parents, because they're having to, especially in the beginning of the pandemic, when they had to adjust to kids being home, being taught online. So they had to be teachers at home, also parents, working parents. So that was something that when I was reading it, I was like, oh yeah, like really related.
One of my coworkers at the pharmacy I used to work at expressed kind of the same thing towards the beginning of the pandemic. Her comment was she's not educated to be a teacher and she does not have the capability of doing it. She said, especially as you got into more like middle school math, she sort of clocked out.
What other roles have you all taken on? Any additional roles?
Personally, I feel like I was already doing this role, and I think a lot of us do tend to take on roles of or taking care of their parents as they age, but especially with the pandemic, having parents who are in high risk of being affected by COVID, I feel like I've had to take on extra responsibilities of being, taking care of them and taking care of uh, extra things that they errands to do and getting them groceries and stuff, which, it's, I was doing that before, but it was more, so I feel like I definitely felt the effects of being a student and then also doing that. So I feel like that was kind of like my main role conflict.
So I normally, when things are not in COVID, feel like I choose to spend more time being a support to my chosen family rather than my blood family. And then and then COVID happened, and my brother relapsed into pretty chaotic drug use. And I ended up talking to him and my parents way more than I normally do. And got just had a really, it's been really stressful. We're separated by many hundreds of miles, but to kind of cope with, access to treatment for substance use disorder. He spent a little bit of time in jail, which was terrifying with COVID. So I feel particularly aware of just like the risks of overdose and COVID exposure in jail and in inpatient rehab. So that's
And this is Ted from South Carolina, AHIC. Just want to share some of my experiences as well, talking about answering the questions. The role that we take on here during the COVID-19 pandemic is definitely much more complicated than what we have right now. Just from like a local standpoint, the primary care office experiences has taught me that the patients sometimes they don't even have enough insurance. They don't have enough medication to have on hand, or they don't even receive the proper care sometimes. And this is definitely worsened by the pandemic. Most of the time, we try to help the patient out, but sometimes the patient they even have a lot of like social problems like transportation, family issues, and just basically unemployment. This is worsened totally by the pandemic. And even from like a global pandemic perspective, like different countries, travel restrictions, economic impacts, just a lot of things that we cannot thought of previously in March, just happening, or it doesn't seem to be kind of see like a light in the end of tunnel at this moment, but hopefully we'll be able to get through this soon.
Yeah, thanks. Yeah, I think that, the first part of this long-term and widespread uncertainty is definitely having a lasting impact. And, even as we speak today, we don't know when this will end. We don't know what January will be like. We don't know what, holiday seasons will be like with our families, our friends, our chosen families, whatever that is, and many people will have fewer family members, this holiday season to celebrate with. And that's going to be a loss as well. So certainly, I think we all have been impacted in ways, even with disruptions to school, your clinical rotations, the way that you receive education. We would have loved to have been in a room with each other. I mean, having face-to-face conversations around tables, but we're in the virtual Zoom world, and, we're making the best of it. And I'm so glad that, we have these opportunities to connect and with people even across state lines and across the Southeast. So thanks everybody for joining and starting us out. That's great. And please feel free to chime in as we move forward to additional questions, and don't worry. If you jump back and around, that doesn't bother me. I'm a little all over the place myself. So, so I just wanted to take us on to the next question, and yeah, do introduce yourself if you can, and tell us what program or what year you are when you speak. That'd be great, as the folks have done tonight. Thank you. So looking at the psychological impacts of COVID-19 across the lifespan, which concept do you think stood out most to you? Was there something that surprised you or that was unexpected, in relation to the various lifespans that they separated in the article?
Hi, this is Masa. I'm the second year student at LSU.
I think we lost audio for a second. She'll probably come back. Masha is audiology at LSU, and I think she's having audio difficulties. So, oh, are you back?
Yes, sorry. Yeah, I think something that was really surprising for me and was unexpected was the feeling of how like unprepared I was. This is like in different aspects of my life, like physically, emotionally, and even economically. So I learned that I have to be prepared for things like this or even like different things. But this was like a unique situation in my adulthood. I think it's unique for everybody, but I really felt like we have to be prepared for like things that may come up in our way. And yeah, and I think it was really stressful for me how I had like some trips coming up, but they all got canceled because of like this limited ability of people traveling. And we were not able to predict how long does it take because they were like announcing the limitation monthly. And yeah, I feel like this was something that when I was reading this article, I realized that we all need to have like these mental health, like some kind of program that make ourselves prepared for things like this, so we can manage it better, I guess.
I don't remember if I introduced myself before, but my name is Michael, and I'm a pharmacy student from the University of South Carolina College of Pharmacy. But the part of the milestones in the article that I thought were interesting, a lot of times in the news and stuff, you hear about how it's affecting either children or like especially like older people too. They have a section on young adulthood though, where they're talking about how like the impact of missing different developmental milestones is having on people. So they're talking about it's like the stalling or regression of those milestones like stops their like independence if they don't get to explore like their like sexual relationships, sexual identity, religious identifications, just from having to miss out on a lot of that social stuff that you would normally go through during this period. I stopped and thought about it, and it's like definitely happened to a lot of my friends. It seems a little, I mean, I know my parents have said that it wasn't too significant, but I mean, even just missing like your graduation ceremony, if this was the year you're supposed to graduate, or missing your senior prom, if you were like graduating high school, I mean, that's a pretty big milestone that you just completely gloss over. And some of my friends who graduated, I know they're stuck at home with their parents now because they can't find a job because of what happened with the economy immediately afterwards.
Hi, my name is Arden, and I'm a second year medical school student at LSU Health Science Center in New Orleans. And I'm kind of piggybacking off of that. I have a lot of friends that are musicians, so like that definitely reading about how like where it talked about how people are um losing that opportunity, like they're losing those milestones, kind of like you were saying, and like pursuits of their choice. And a lot of my friends that, you know, were going into music or like other careers that it kind of, you know, there's definitely like a period of startup and it can be a little uncertain even in times when like the economy is very stable. A lot of them are like looking into second options for careers and for choices. So I think like an interesting thing that might come out of this is that a lot of those like careers that might have been considered like quote unquote maybe like ambitious or like kind of like something that involves like a leap of faith or you kind of have to just kind of jump into it. A lot of people are kind of resorting to things that might be a little bit safer, quote unquote, or that don't involve taking that risk and might be a little bit more financially stable. So I definitely think that from this, some careers or like jobs that people might commonly go into, there'll be like a period of people, especially like around our age, that might do other things because of the uncertainty that this pandemic has kind of presented to them. And they realize like learning about, I guess, how, you know, that it's not guarantee and there's not necessarily safe economy. I think there's a lot of people that might pursue careers that they might have otherwise not because of that.
Certainly, I can think of a lot of people in our state, and I'm sure in your state as well, are now contact tracers for COVID-19. So there's that role and job that has never been here before, but I certainly hear you. And when our state kind of approached us about educating contact tracers, my first response was making sure that those folks who were furloughed and put out of work because of COVID-19 should be the first ones to be at the front lines to assist with those jobs. People with healthcare experience with infectious diseases. So anyway, that's definitely a new role that's, you know, come out and been more important and a safe bet for now. And I'm sure for folks who were, you know, in temporary positions, they might consider those some temporary roles or to get into public health, to start in public health. Anyone else? What else surprised you?
Uh, Jennifer, could you clarify the question or elaborate a little bit more in regards to like what surprised about what I might have missed it or zoned out?
Oh yeah, just what do you think surprised you about COVID-19 mental health impacts across the lifespan? I was still on that one. I was just going to see if anybody else wanted to weigh in.
Got it.
I'll say something. I'm Valentina. I'm a third year dental student from LSU. And I thought it was surprising. I mean, not surprising, but I never thought about this. And it's like the older adults who take care of their parents, for example, like parents who are old and compromised, like Alzheimer's and things like that. How the caretakers, who are usually the kids, um, are just stuck at home more, and it affects like their health too, their mental health. And then there's more like suicide and PTSD and anxiety and all that. And so I mean, I knew the pandemic took a toll on all of us, but I didn't think about it like it affecting the numbers of suicide, for example.
Hi, I'm Desiree. I'm a second year MPH student. And also, I guess what was surprising or just most eye-catching was also the middle adulthood, and when it talked about like parents having to do work and like helping their children with school. And for me, that stuck out because my mom is doing that with my little brother, and just seeing how frustrated she gets with like having to do her full-time job with no type of, you know, I mean, I guess there's really no accommodations at the moment for considering that you have to watch your child do school and make sure they're doing what they need to be doing because there's no teacher there to help them through with anything that they're doing. So just, I didn't really think about the mental aspect of that with having to do both of those roles on top of everything else you're already doing.
Hey, I'm Shakara again. I'm a clinical psych student. I think the most surprising one for me was the adolescents that were impacting a lot of their identity development by not having face-to-face opportunities to be with their friends and their peers. And I thought that was really interesting because I think at first glance you go, oh, well, they're connected on TikTok or Instagram or Facebook or whatever, the social media, but that really isn't the same thing. And viewing things from a developmental point, I think that is going to have a lot of ripple effects on our peeps.
I thought about that as well, because as you know, you like even with video conference, when you turn the video on, you somewhat perform a little bit more because you know people are watching you, and it's some unconscious, but it happens. I think the other thing with social media is people you all know say things that they may or may not say in face-to-face interactions. And so again, if there's more dependence on that and that reward system of, you know, how they're developing socially and emotionally and cognitively, it is interesting. I think one of the things that really got me was that there was talking about the mental health curve that may be coming, you know, like that we're going to have, like right now they were talking about addressing the physical health needs and shifting. How are we going to be shifting into the meeting these needs, this mental health, you know, curve that may be coming our way? And it's impacting care providers, frontline healthcare providers, you know, first responders. Think about the number of first responders' lives who have been lost. I mean, it's really astounding when you think about that, even across the U.S., because they were in, you know, they are on the front lines. And so anyway, those are the things. So anybody else have anything to think about, like the future and how we may be able, or what things we need to be thinking about for the future? And when I say future, I'm talking about like next 3 to 6 to a year, 2 years at the most, probably.
Concerning about the future, I have like been reading a lot of articles about because everybody's keep asking when we're actually in the practice asking about when the vaccination for the COVID-19 is going to come out, but there's still a lot of uncertainties whether or not the vaccine comes out, which I'm kind of pessimistic on that vaccination right now, which is proposed to be released next year. Um, other than vaccine, I think we should definitely focus on what's the new normal of like what we can take on post pandemic, or just basically in 3 to 6 months, what we can do to kind of slow the spreads of virus and try to keep the case down in like a descending trend. Other than that, just basically practice the public health measures that we can do daily. As long as we could become more responsible, just like today I see like a flow chart for the daily COVID-19 updates from state to state provided by national data, saying that South Carolina used to be ranked number 3rd in the highest ranked case in like in August, but right now with all the public health measures that South Carolina has implemented, I think South Carolina has like one of the lowest among the last bottom states. I think they're only like 5% positive rates compared to there currently 7 states. They're like over 10% positive rates.
This is Nora. I'm in the medicine program, 2nd year with Arden in New Orleans. From the article that we read, there were two particular things that stood out for me for actions in the future. One of them was they talked about something that I hadn't really heard of before, which was like, and they had an acronym for it. It was like immediate short-term behavior or something. And it was
acute stress disorder. Is that what the one you're talking about?
No, it was an intervention that can be delivered. They said like
SSIs, those short interventions.
Yeah, the short interventions.
The single, I wrote it down, single something.
I feel like it was SII or something like that. But I was definitely interested in like reading more about what data is out there. And also, you know, I think there was a proposal in the paper to get more studies of that. But then the other thing that I was thinking about was at the systems level, right? So I think there's only so much that all of us as individuals can do in terms of self-care. And there's a lot more that, you know, our employers or our healthcare systems or our, you know, university system could do to have a bigger impact on overall wellness. And I was thinking about in the paper, there was, they talked about data that shows like interaction with non-human animals and nature has positive effects. And I was thinking like, how cool would it be if these huge employers in this hospital like did more to advocate that we had like more parks and like more time for outside time and like more time for breaks and for lunch. You know, I just don't think it's necessarily should be on all of us as individuals.
Absolutely. I think I just will point out before the pandemic, you know, you might have heard about resilience, and there was this big push that, you know, that it was that we would have resiliency trainings. And don't get me wrong, I'm not against resiliency or resilience, but one of the things that I study is like teamwork and culture in hospitals and teams and primary care practices. And it's just really important that these systems and organizations also do their part in the resilience. And just like you mentioned, providing the outdoor space, you know, places to go and meditate if you want to, for women, you know, like I know that in our hospitals, we now have lactation rooms. I mean, it's just these things that make everybody's lives a little less stressful every day. And if we can build that into everyday lives, I agree with you. Organizations, institutions, offices, you know, and you all as future leaders, you know, you could be leading a clinic, a practice, a team. You know, how are you going to help build those resiliency and self-care techniques in your practice? If you have, you know, I hope you all have influence on leadership and organizational decisions moving forward.
I don't know that this is in any of our wheelhouses, but I was reflecting on, I had an internship at the UN in New York City, and on a lunch break, you'd go out to these, you know, they're skyscrapers, but on the first floor level, there would be just like really beautiful, expansive like tables and benches and plantings, and then sometimes they would just be like really big indoor spaces too, like if it was raining, that were just public, and everybody that was on their lunch breaks was out there. And I don't know that I've experienced that kind of like design any other time, but I thought that was very enjoyable, that there was just all of this nice space.
All right. Please jump in. And I was going to say, again, the single session interventions, I know there's, can't remember your name, but there is a psychology student on the call. I didn't know if anybody on the call had ever heard of single session interventions. One thing that I have heard of is the mobile health, and so they also talked about like you started to mention like non-humans, but they also mentioned like these mobile health like apps or personal wellness apps and interventions that can be done through mobile devices, through your phones, your iWatch, all of those things, Apple Watch. I always do that. I don't have one, obviously. But those are things that, we at the Medical University of South Carolina, they've done some interventions around asthma. So teaching patients through videos that they can download to their smartphone, teaches like, especially pediatrics, interventions that they can, how to breathe, how to use inhalers. I mean, these are very, very useful techniques. How can we, like one thing I was thinking about was how can we utilize that more on the mass levels so that these, our limited resources, which I think in our country are, psychiatrists, whereas we have more social workers and therapists, and the, psychologists, clinical psychiatrists prescribing medications are very, few and far between. We always have mental health shortages, but that's just something I was thinking about. How can we integrate these techniques more into primary care, or even thinking about like at your pharmacy, even in retail pharmacy. I mean, a retail pharmacist sees patients more often sometimes than their own providers. And so how could we build in tools or in mental health interventions in ways, I'm come from a public health perspective. And so it's like, how do we make the healthy choices the easy choices, right? So how can we build a system to address these in the places where people are when they need them and make them the easy options?
I think about the singles. Oh, this is Shakara again. I'm in the clinical psychology program, and I think a lot of the single session interventions that I have done have just been about psychoeducation about stuff. We'll get referrals from the nutritionist or the MD, and a lot of it is psychoeducation or normalizing what clients kind of perceive as abnormal or unusual. And I think a good goal for everyone as a clinician would be consider how we can add in culturally grounded practice into all of our daily practices. And so I found that a lot of people, like a lot of the audiologists, the people on interprofessional teams think that single session interventions have to be this huge ordeal. But oftentimes people come to us and say, oh yeah, my doctor said this really great thing and taught me this skill. And I went off and did this thing. And that in and of itself is a single session intervention. So don't discount how much work you guys are doing. Everyone, when I say you guys, I mean everyone. Don't discount how much work you're doing by providing some skills, because that's a lot of what these single session interventions are, providing skills and education about something. And I also find it beneficial to, if you can, this is a big, tall order, but if you're doing community outreach or community engagement, find the leaders in that group and teach them the skills, give them the psychoeducation, and they will go out and spread it to an entire community of people that you may not have as an individual been able to reach, because let's face it, there's 10 providers and 400 people that need you. But if you teach the community leaders and teach people that are prominent in the community those skills in a single session, then they'll go out and spread that information. And you have just touched the lives of at least triple the amount of people you would have been if everyone had to come to your office. That's my little spiel.
Certainly. And when you mention those things as SSIs, I think about like health coaching. I don't know if any of you all have been, taught about health coaching or even motivational interviewing, around a certain item. Teach back moments when you're doing teach back with a patient, if you ever utilize those techniques. Certainly, those are definitely a good point. Thank you for sharing that. Others?
Hi, this is Arden again, second year medical school student. I don't know if this is kind of going off of the question, but I think one thing that the article had talked about was the use of telehealth. And in terms of getting those resources to the communities that need them the most, I think that that is one thing that I think we can say that's come out of this pandemic that's been positive in healthcare in particular is just the expansion of telehealth and its use. And I think, a lot of people, especially like I think some people might underestimate its use and like kind of dismiss it because like and it's valid that there are certain things in healthcare that you just can't do over the phone or over video. I mean, there are some things that you need to do in person, but I really think that the use of telehealth, like for example, if you're doing like motivational interviewing or something, like it's something that can be done over telehealth and providing people skills maybe to come up with the steps for how they want to move forward is something that you might be able to do over telehealth. So I definitely think like the use of it is gonna expand as we go forward just because we've kind of been forced to learn how to use it and the article kind of talks about that. But we've been forced to learn how to use it for in the over the course of the pandemic. And I definitely think it's gonna open a lot of doors to be able to empower people with kind of taking control of some of their own health that we might not have been able to do in the past.
Yeah, I think my statement I would say for telehealth is that one that I say a lot is that one, I think telehealth is an awesome tool and it is implemented in the structural issues that are already present. And in this current pandemic, just like many things like mental health, it can exacerbate the issues that were underlying already, and can make things worse, but it can also be very impactful and helpful and beneficial. And so I like telehealth. I'm a proponent of telehealth. I always say just we need to think about I use the realist evaluation. Who is it useful for? In what context? Who will be most benefit? Who will most benefit from it? And utilizing that, and then looking at hybrid models. How can we integrate telehealth in addition to in-person checks as needed and things like that? But I want to hear from others. What have you all seen about telehealth and especially in this time, telemental health? How can we leverage telemental health right now? Well, I will share one thing that I learned. I was attended some webinars on telehealth interventions across the U.S., and this was one that I'll share because I think it shows the teamwork that is needed in caring for complex patients. And so it was a pediatric occupational therapist, and she was in Georgia, and she started utilizing telehealth during the pandemic to be able to reach children, pediatrics with severe mobility, so they needed occupational therapy. So she was able to get to people that she's not been able to in the past. And she was able to see them multiple times in a week because she said in the past, those folks, it was over an hour and a half away drive. And so they could really only afford to come once a week, if that. And so she said with the use of telehealth, because people are at home and the child was at home because school was not in session, they were able to do occupational therapy sessions from home. And so there are some benefits and uses of telehealth that I'm definitely seeing. Drive-in or drive-through vaccine clinics and things like that. But I'm thinking about how can we integrate telemental health, even in primary care or what are y'all thinking about with this massive, what kinds of solutions are you thinking about moving forward? Even not telehealth, but other solutions too. And I guess how are we going to make sure to improve mental health services for those specific populations that were mentioned in the article? Definitely racial and ethnic minority groups and healthcare workers. So thinking about those populations, how could we improve mental health services? And for those, like it said in the article, especially for those who may have, be at risk of an increase in mental health, an exacerbation of mental health in their lives.
Hi, this is Desiree again, MPH student. I think a big part of making sure that everyone's getting what they need and it's running smoothly is just evaluating what's going on and like doing a lot of research studies. This is definitely a new predicament with COVID-19 and doing telehealth. So just doing research to see what's working, what's not working, from both aspects, the healthcare provider and the patients, because that'll just be really telling of what is working and what needs to be improved. And from there, things can really get better.
Hey, this is Massa again. Also, I was thinking about some programs like CEU things that we have, continuing education. I was thinking about like if we have some kind of programs like this, people get updated with like things that can help them to have better mental health, or can like be familiar with things that can help them. I think that is also better. Like as a student, we do have advisor, we have like phone numbers that we can call in case of like issues that we have, but we haven't had like any like a routine, like a class that we can or we should participate to get familiar with things that can help us. And these programs can be for different, like they can adjust the program for different groups, for students, for like healthcare workers, for like different age students. I think that can help.
Great, thanks. What else? What other solutions or ideas did people have?
I'll just add one more point, and I probably forgot to introduce myself in last answering. My name is Ted, and I'm a third-year pharmacy student at USC, and also attending a lot of, try to attend a lot of AHEC sections because they're really meaningful. So with the incorporation of telehousing to current practice is definitely really beneficial, especially from my experiences at retail pharmacies and primary care clinics. But before we get into like the specific populations, one concerns I have is that everybody in the healthcare team, no matter what profession you represent, we're trying to reach a common sense that if everyone on the healthcare team have like the same knowledge about how telehealth is going to be working with our patients, if somebody on your team that does not have the enough knowledge or like what their responsibility is or what their role is into the healthcare team, or simply just like the telehealth compared to conventional face-to-face treatment or diagnosis, that could cause a problem before we even get to the patient. And secondly, I just want to mention that it's for specific populations, mostly as I was dealing with patients with polypharmacy and patient with like over 30 medications, it's another problem. How do we make sure that the patient is adherent to their medication during the pandemic while they're at home? Because we cannot be able to talk to them in person and try to make sure that they're taking their medications and adhere to any type of other treatment like physical therapy. So I guess that's another concern I have is how do we, and try to sum up is how do we actually incorporate telehealth into our current practice through like a whole collaborative effort through interprofessional practice and through the involvement of patients at home.
Yeah, certainly. And just like, as you know now, electronic health records are really important, and that's where we get a lot of data from. And it's one of my concerns, and being, you know, with telehealth from the beginning, it's definitely an issue, you know, because who are you getting your services from? Is that electronic health record connected to the other providers that that patient is seeing? You know, are they connected to what we call, you know, a primary care home, so that there is that coordination? And who's going to do that referral? How do you, as the provider, then let someone at your office, there might be a care coordinator, a patient care technician, a social worker. I mean, there's all types of folks who might be assisting in that care coordination role in a practice. How are you making sure that that information is getting back to that person? You know, whereas in the past, you might say, okay, go up to the front and, you know, Pam will help you get your appointment set up. You know, what do you do now with telehealth? How do you do those things? And making sure everybody's trained to do that. Another thing that I know we've talked about in other sessions is how do you, if there's labs or screenings that need to happen for patients, right? And so I think about with telehealth, how are we incorporating like SBIRT, you know, short behavioral interventional interventions around alcohol and drug use. I mean, like, think about, we all know, especially from the article, like there's this increased potential for substance and alcohol use. So how are we making sure that with these telehealth visits, that when maybe a medical assistant or it was a part of your intake previously, you know, some type of survey or some type of question, you know, how are you making sure that that's happening when you transition that to a telehealth visit? And those are definitely things that I am concerned about as we move forward. And the rates of intimate partner violence, how are we screening for partner violence with, you know, so there's a lot of things that I feel like, and just like schools, and, you know, I'm sure you've heard schools are concerned about lost children, you know, children that they've lost contact with because they may not have internet, or, you know, what, you know, they've lost their homes and so they don't know where they are anymore, and they've lost services to mental health services as well as educational services. So like those are the things that I think about. I'll stop. But so especially with telehealth, we need to be thinking very much about what's happening in our current social context, you know, what's happening in people's lives. So that's one of the things, I don't know about y'all, but I really liked about this article was that it helped us. And so at least for South Carolina AHEC program, we are definitely focused on primary care and prevention. And so, you know, across the lifespan, understanding how this is going to impact everybody. And so for those children, it's those, you know, for young children, how this impacts parents. For you as students, how is this impacting your careers or your aspirations or what you want to do with your career later? All of those things. It's I think one thing that I just want to say is that, at least from working with individuals and having a diverse staff that have multiple competing demands on their time right now, I have one person, and I'm going to guess that a lot of you all like to get a lot done. You might be perfectionists. You might be like type A, maybe. High achievers, maybe. And so like I have someone that I work with who is very much that way. And this person had a lot on their plate. And I said, look, I know you normally give me like 110%, but right now, 70% is okay. And she said, but that's failing. And I said, that is not failing right now, because our own self-care and taking care of ourselves and making sure we are all okay is more important than everything else right now. Because if we don't show up with our full selves to the best that we can be, we can't help others. And in this profession and these professions that we're working in, I think that's really important. So take a minute to reflect on all the things that you do during these difficult times, and acknowledge that it is okay for us to take a minute and just not do, full steam ahead 110% all the time. Anybody else have those feelings?
Hello?
We can hear you.
Okay. No, I was not. I definitely resonate with that because I definitely had to tell myself to slow down several times before. And even now, like unconsciously without realizing it, I'll pick up a lot of things to do and then stress myself out and then, not realize I'm burning out until I'm burnt out and drop everything at once. So definitely resonate with that. And I'm trying to reflect on that right now and think about ways I could better take care of myself. Yeah, this is Harmony, by the way, in New Orleans.
Certainly. How have you all found ways to take care of yourselves, or, just kind of take a moment?
A big thing that me and my friends have tried to do is you tried to have at least one thing to look forward to always. Even if it's something small, just like getting dinner at a restaurant or something that week, or going on like a weekend trip every other week or something like that. Just something to look forward to get through the day, is really motivating.
Piggybacking off of that, I actually just started doing that as well because I'm literally in my room all day. So just something small like talking to a friend or like ending my day a little early to watch a show. I also just love to go on walks. So that's kind of what I've been doing to kind of like clear my head and like make that my me time.
I know I have been walking more, and I think my flowers look a lot better. I try to spend time outside when it's not, 100 degrees, right? And the humidity's 99. But that's what I'm looking forward to this fall, thinking of something to look forward to. That's what I'm looking forward to this fall, is a little bit more time to just be outside and not think about everything.
I think definitely relate to a lot of the things you guys said. I feel like I've dealt with these like since pandemic started and the quarantine itself, and kind of like self disciplining and keeping myself in routine in different ways. Definitely burnt out several times. I've slowly realized is that after I was pretty on like I was able to regulate or keep a routine for a while in the beginning of the pandemic. But after that, I started noticing that every 2-3 weeks, I would have a day where I would just be very unmotivated. I would procrastinate a lot and just push off tasks. So I think I would stress myself out when I'm doing that, because in my back of my head, I would think, oh, I need to do stuff. I should do stuff. But then I think it helped to just just know that that's going to happen, and then use that as a day to just like I knew it was happening, and just use that as like a relaxed day, even though and I think it's worked so far. I don't know how long it's gonna work for, but every couple of weeks I have a day where I'm very unmotivated and I just do nothing. And it's kind of similar to what you guys are talking about, kind of just taking a break, taking a foot off the pedal, and it helps. And then I know it, like, within a day I would feel motivated to do the work again. So
Anyone else found some ways to decompress from all that is facing us every day? And it's like was mentioned, it's long-term uncertainty, a lot of changes. We talked about changes even in workflow at your practice if you're working clinically, routines at home, how you meet up with your friends. I mean, we talked a lot about, the article talks about social isolation. I think about, all kinds of things. So let's, what other things have y'all been thinking about from the article that you wanted to talk about tonight? Well, I will throw out stigma. I thought that stigma was a bit of a theme in this article as well. And I'll just say it's stigma in multiple ways. Stigma of COVID, the illness, stigma towards mental health, in like mental health, in general, just mental health disorders, the field of mental health. Then, stigma around getting mental health services for some populations. And then just the stigma and the discrimination towards Asians and Asian Americans in the US currently. And so like that, there's multiple stigma. And I just, if you study population health, you understand that this is going to happen. But, how can we try and also make sure that those stressors are addressed at, maybe in ways massive, across our populations?
Just to add on to what I've noticed with the stigma stuff just out and about is everything you've said for sure, but also anyone who gets the virus also is a little stigmatized. A lot of times they're sort of portrayed as, oh, if you got the coronavirus, you were being irresponsible, you were not socially distancing, that sort of thing, when in reality, you could get it very easily from just going to work, or depending on what your workplace is, if you're working in a restaurant or something else where you have to interact with people, healthcare workers too. Or, I mean, yeah, you could just go into the grocery store, you could pick up COVID, but they're stigmatized for it anyway, which is a shame.
Yeah, I feel like another stigma is that it's young people's fault. Like we're partying, we're wild and want to get together and hang out. I mean, I'm sure like it does happen. I'm not saying that, but like also young people just went back to work. That's the reason like why they're getting sick. And I see it even with my family. Like they put like a lot of blame on our generation. They think like it's my friends and my co-workers and classmates who are spreading the virus, but really it's anybody else too, not just young people,
Right. Anyone else? Great points, folks. How can we help support those who are stigmatized, or how can we help reduce stigma in your roles?
I think there's something to be said for talking about stigmatized things more freely and more openly and with more people. We were learning with mental health in particular that you should ask very like bluntly and very directly in order to like ascertain sort of like a realistic answer. And if you start incorporating it where you're asking everyone and not just targeting it at certain people, it sort of destigmatizes it over time.
I think one thing that also with COVID is that a lot of people, like all of us some way, like regardless of the age groups, I think have lost, like we've all lost certain coping mechanisms that we use. Like we were talking about, like things that we've used to maintain our mental health. Like all of us have lost something in some way, shape, or form. And I feel like younger adults, it's more common to talk about like mental health and mental well-being than in older adults. But I think part of that is also like it comes with like, as when you're younger, you're still like, you're searching for your identity, you're still not quite set in the world. And then once you get a little bit more settled, people tend to kind of think, well, if you're having mental illness, then that's just because you're not working or you're not doing this or you're not, and they don't really equate it to disease. But I think just the fact that everybody it's suffered some mental wellness issues over the course of this pandemic kind of has made it to where people realize that it's not something that you necessarily have control over. And like, it's not something that just happens to young people or like young people just complain about it, but that it's something that could happen to anybody. So it like opens the door to having conversations about the fact that, it's an illness, just like, if you had like the stomach bug or like if you had like something, like if you had something wrong with any other part of your body, like it's just a tangible illness that can be treated as well. So I think that COVID has kind of helped to open that conversation because everybody of all ages are experiencing the effects of mental health due to COVID.
This is Nora in New Orleans. To build off what Arden was saying, I felt, I think the article that we read had some notes of hope that because there was kind of a universal loss of coping mechanisms, that there could be a lot of work to undo stigma about mental health issues. And I think that earlier in the year, I had a lot of hopes like that as well. And I'm not sure that I still have those for, my future patients or society in general. But I do think that among my friends who I actually talk to, and then also the people that are in my social media circle, there is a lot more frank discussion about mostly like solutions-based discussion. So like, what kind of humor helps you get through all of the stress, stuff like that. So I don't know if other people have had that in their social media feeds, but I feel like a lot of the time I'm hearing, different strategies that people have come up with.
And just to add to this discussion as well, this is Harmony. Can y'all hear me?
Yes.
I think being careful to reduce stigma, I think being careful with our public health messaging is just a big piece of, I think, why a lot of people lost coping mechanisms, or they might be shamed for having the virus because we have all these messages that say, okay, you need to do this, you need to do that. If you're not, you're a threat to the community. Even something as simple as having, said social distance instead of physical distance, I think had people in a state where they, I don't know the words, but even for example, I'd say at least in the beginning of the pandemic, something as simple as, hanging out in the park with friends 6 feet away would have been frowned upon. And that activity is not without its risk, but at the same time, I think that's one of the kind of safer ways to socialize. And that wasn't something people were, necessarily looking to do because, we hear the message, social distance, social distance, social distance. So anything that is kind of more mindful of how stigma can be used and has been strategically used by public health messaging to get people to do things. But I think we need to be careful with, what are the consequences of that, etc.
Hi, this is Shakara again. I'm from the New Orleans AHEC. I'll add that talking about it is destigmatizing and normalizing it using terms like anyone in your situation, or we all are struggling with this. When you include yourself, it's a lot more like, this is your problem. I need you to send you to the psych people to get this worked out. It's, yeah, we're all having a tough time right now. Anyone in your shoes would be having, you lost your job. You also have all these other things. We terms are really beneficial at destigmatizing. And I also will go out on a limb and say to try to avoid, I call it toxic positivity, where it's all about, you're having this problem, okay, we're just gonna fix it, without letting people sit in their emotion and recognize and process their emotions. And I understand I'm all for solution focused therapy. I love it. I think it's great for some people, but I also recognize the need to, you had a crappy day, to be sad or be angry or be whatever it is. You're having a crappy time. Just give them space to have those feelings instead of trying to eradicate them so quickly.
Great. Great. Very good comments. I appreciate everybody's engagement tonight. I have learned something myself. I would say that one of the things that I, struggled with early on was immediately working from home with my partner, also working from home, like 10 feet away from me. And he's not here tonight. But just even in the beginning, like how we live with the people that we live with, um, definitely can impact everybody's lives. And learn, I think we've all learned a lot from COVID. Like we probably have all learned the little things that we want in our house and the little comforts that we can find. So I think, I like to look at the positives, not that, but at least some positives as we look at the pandemic and move forward. So just if you wouldn't mind indulging me a little bit and just, tell me, kind of what do you think the point of this was tonight? Do you understand, is there anything that you understand a little bit better? Or, just in general, what kind of takeaways do you have, I guess, from this session tonight? I'd love to hear from as many as possible.
Hi, this is Desiree, New Orleans. I guess one thing I kind of was thinking about the whole time we were talking is that, yeah, we're going, or I guess, okay, let me back up. For me, during this whole pandemic, I feel like I struggled with, we're all going through it, so I shouldn't really like, there's no excuse kind of thing. And I feel like as we spoke today, it was, I feel like kind of changed my mindset that, yeah, we're all going through it, but everybody's going through it in a different way and is reacting differently. So you have the right to process it the way you need to process it. So I guess that was kind of my takeaway, or just like my aha moment as everybody was talking.
Thanks, Desiree.
I think my takeaway from this session and the article itself was, I feel like since COVID started, the pandemic started, I've personally, me, and I've just also seen in media, obviously we are all so focused on the physical detriments of the illness, and rightly so. But sometimes, it overshadows, like, which is what we're discussing, the mental, like the implications that can happen, which we're going to be able to or see for a long term, or even now seeing. So I think it kind of brought the issue in the forefront for me. Just reading about it and like realizing, oh, there's like research happening about it, and eager to learn more about it.
Hey, this is Jansen. I'm a fourth year audiology student at LSU Health Sciences Center. I'm actually doing a residency right now, and I liked this. I liked the way the article kind of just broke everything down. It was like, for specific patients, and it was like, look, everyone is gonna need everyone is affected by this and everyone is going to need some help. So it's kind of like you're just going to have to like take a step back and be patient with not only yourself, but your patients and other people you're seeing. Because everyone's going to like it was mentioned before, like everyone's going to process differently. Some people are going to be able to just get over it really fast. Some people are going to take time. Some people have, other illnesses that are just going to exacerbate this. So it's a good kind of, I guess, way to recenter yourself.
Hi. One thing that I think I've taken away from this is, I mean, hopefully we don't have something like this happen again, but I mean, as we've seen, nothing is really certain right now. And so I think it's been really useful to hear, especially other people that have different roles in the healthcare team, there just to listen to their perspective about the article and about the way that we've handled this pandemic, whether it's through like the public health measures or through just actual patient care, and to get that perspective, because ultimately I think having open discussions with other members of the healthcare team will make us each better at our own respective jobs, and that only ever benefits the patient in the future. So I definitely think it's been good just to see how other people in other professions are handling the situation and are thinking about it in light of patient care, and how I can use that in the future to impact my own patients.
I know others have thoughts. I'm going to give you a minute. Just some other questions, I guess. Anybody else have questions for others on the line? I would say one thing I would also just point out that was surprising to me. I mean, it's always surprising sometimes when I see these numbers, but that even pre-COVID, 67% of adults and 80% of youth in the United States had mental health needs that were not being addressed. And so I just think about, as someone who looks at the healthcare workforce, and that's kind of what this AHEC Scholars Program is about. We're trying to make sure that there's healthcare providers, where we need them to help those in the who need the care the most. And so I just think about like, how are we all in all of our roles? So from being a pharmacist, an audiologist, public health professional, a doctor, a nurse, how are we all going to think about mental health and ways that we can address these issues on a wider scale? Well, I keep thinking about that. I see you all as the future of healthcare, and I hope that this program, the AHEC Scholars Program, is exposing you to things and that help you innovate and think creatively about the ways that you might be able to think about this differently in the future. I will say a little plug that mental health first aid. So there are programs for first responders and EMS professionals, nurses, law enforcement. I mean, all across the board, there are mental health first aid courses that are available, and those are utilized to help reduce stigma. And so those are things that we can all do and help implement, even if you work in a practice in the future. And Just as a last minute plug, I wanted to let you know that in South Carolina, we are hosting a virtual telehealth summit that is starting tomorrow, October 9th. It's like 8:45 to 12:30 the next 3 Fridays. Registration is free. So it's free, it's virtual, and the best part is you can just once you register and get logged in, you can you can view the programs between October 9th and October 23rd on your own time. So if you can't make the live sessions from like 8:45 to 12:30, that's okay. Just register, it's free. Again, it's the annual Telehealth Summit of South Carolina and Palmetto Care Connections. I had the link up, but if you're interested in telehealth, I think that there's some really good thought leaders who are going to be there doing some keynotes. Last year we had this guy from the FCC, and it just was amazing to think about like how our cars, like are going to be devices that are going to, and they've already happened, like our devices. There you go. Thank you for the link in the chat box. You're awesome. But like last year, they talked about how like cars could be healthcare delivery devices in the future. So if you're in a Tesla, it can determine whether you're having irregular like heart rhythms and things like that. And so it's literally pulled people over and gotten an ambulance to someone in a car, and they end up in the hospital. So even like that, to me, I hope that you all will think creatively and innovatively about how we can address some of the issues that face us all. And we don't have to do it alone. We have a team of great people around us. It's just finding those resources and finding your passion and working towards that. So hopefully I will look forward to seeing you some at the Telehealth Summit. We also have some classes on telemental health. We did a telemental health course this year. If you want to learn about ways to provide telemental health services for yourself or your others. Thank you all for your time. Any other questions for me? For the South Carolina folks, the evaluation code is journal. I'll type it in. But if you will just complete the evaluation, it's 2 questions, so that you can get credit for your AHEC Scholars Credit. I typed in
Louisiana
journal.
folks, your evaluations will be in your inbox. The invite for your evaluations will be in your inboxes shortly. I think I set it to come out at 8 p.m. So you get an email.
Thank you all for sharing your stories and helping us learn from each other about your roles, about your personal experiences with COVID and everything. So thank you all for sharing. It really added to the discussion. I really enjoyed meeting and talking to you all. So thank you all. And I wish you all health and wellness in the future months and years ahead.
Thank you to everybody. Have a good night.
Thank you.
Thank you.